Dr. Choll Kim here from sunny San Diego, California. We are getting started. We have a very young active patient. He's a DJ from Irvine, and he's got this problem right here. Isthmic spondylolisthesis. This usually occurs at L5S1, but this is a 4-5 isthmic spondylolisthesis. You can see the pars defect right there, that space there. And there's some motion on flexion extension views. It's mostly angular. And that disc is not doing so well. It's bulging out and pinching the nerve going down the left side. And of course, everyone's told him he needs a fusion, which he probably does, but most people in the know, especially if you're only 35, they do not want a fusion with screws and rods and cages. He's got mostly left-sided leg pain. So we're going to try the most minimally invasive surgery possible, the less procedure, so that we can go in there and treat this disc protrusion right there, an annular tear, along with that neuroforaminal stenosis right here. You can see it bulging up, so I have to stay really low and work backwards up toward the nerve. The nerve is squashed way up there. It's like a little crescent. And by doing the less procedure and going transforaminal, we'll minimize any instability that we create during surgery. We call that iatrogenic instability. Iatrogenic is the medical term for caused by the physician. And that way we can put a little Band-Aid on there and get him back to his wonderful life quickly and with minimal post-op pain. So wish me luck. Look at that cockapoo-poo. Shot and save. Shot and save. And poo-poo right there. So that's where I went in. This is that annular tear that we see on MRI. See how it's blue right there? And it's empty. This disc is floppy. The exiting nerve root is up there. We're going to deal with that last because it's the shyest of all the nerves. Does not like to be looked at even. Lots of inflammation. Oh, this disc is so pathetic. This is what the center of the disc looks like, very, very blue. I usually don't have to go inside here, but not on this one. This one, it is cockapoo all the way to the center. You know that rock in your shoe that's bothersome? Here's the rock in your shoe, right here. A piece of it. Look how hard and rubbery and pointy it is. So when you stand up, this thing goes straight left into the exiting nerve root. And then it goes medial to the traversing nerve root. So that's got to go right there. So does all this. Oh, the laser's working beautifully on the pebble. It's magical, I tell you. It's magical. That would have been such an annoyance to get off. I'd have to probably use a mechanical instrument to grab it and pull on it and rip it out. And I'm not a ripper outer. I'm more of a delicate pinky out kind of persuader. Did I mention I love the laser? That's the bone spur. That's pushing all this into the exiting nerve. Look at that, it's like a pimple waiting to be popped. Oh, look at this. Little booger. Look at that little poop right there. It's like my punk teenage kid's not going to come out without a fight. A little bit more cooperative than my punk teenage kids, sorry. Just a little. Oh! Just like my punk teenage kids, it's a little sneak. Look at that. Look at this now. That's where the disc herniation was. Now I can see into the canal. It's going to bleed like stink. My articulating downgoing curette that I used to push down on. It's called the salt and pepper. I don't know why though. Because I'm just pushing it Real good. Okay, all done. I got all that bulk off. Got all the loose pieces of disc out. This disc was pretty pathetic. The nerve that's going across, called the traversing nerve, is free. And then here's the exiting nerve root. That's the one that was really getting pinched. Ooh, look at that. Happy, happy. Praying that you get better and that you can get back to your busy life with a little Band-Aid on your back. Look at that cute little poke hole. It's tiny. I bet you won't be able to find it later. Followed by the world's most expensive Band-Aid. I took my time and I was meticulous and thorough and did a really extra careful job making sure that all the extra stuff was gone. That disc was caca-poo-poo, but I'm really expecting a great result, and we're all praying for a speedy recovery, so best wishes.